Hello everybody, welcome to Academics in Nutshell. Today we will discuss a virus which hasn't caused a wave like COVID but definitely caused ripples, the multifaceted adenovirus. What we commonly associate adenovirus is with the epidemic keratoconjunctivitis, which typically presents with a painful eye, extreme photophobia, watering, redness, and there are often similar complaints in other peer groups also, because there is very easy transmissibility of this viral conjunctivitis. On the other hand, it may also present as acute follicular conjunctivitis, which is typically unilateral, associated with serous drainage and cervical adenopathy, and there are follicles seen in the bulbar conjunctiva. The other presentation that's very often characterized with adenoviral infection is the pharyngoconjunctival fever, where in addition to conjunctivitis, there is extreme pharyngitis, painful throat, and cervical lymphadenopathy, which is often a characteristic feature, and the child looks in great discomfort. So the spectrum of adenoviral eye diseases might be epidemic keratoconjunctivitis, follicular conjunctivitis, or pharyngoconjunctival fever. But adenovirus may also cause other features. Like this, a 3-year-old boy with fever for about a week, upper respiratory features, sore throat, on examination cervical adenopathy, tonsils enlarged with follicles, typically brassy, barking, hoarse cough, and often respiratory distress after about a week. This is a typical acute adenoviral pharyngitis and tonsillitis, and often it culminates into acute laryngotracheobronchitis also. In fact, acute febrile pharyngitis is the commonest adenoviral infection in school-going children. In younger children, like a 11-month-old baby with cough and cold for 3 days, a fever of a day's duration, then presenting with respiratory distress, feeding difficulty for about 12 hours. On examination, tachypneic, low saturation in room air, there may be rhonchi and creps in the chest, but typically the CBC-CRP are normal and the child usually improves within 3 to 5 days. This is acute bronchiolitis. And adenovirus accounts for 5 to 18% of bronchiolitis, and some of them may cause respiratory complications also. Adenoviral pneumonia actually is the second most common viral pneumonia, only after respiratory syncytial virus. The severe and fatal illness is often noticed in younger children, like 3 to 18 months. Typically, the adenoviral pneumonia resembles a bacterial pneumonia with high fever, lower infiltrates, parapneumonic effusion, and often the blood counts and CRP may be like a bacterial pneumonia. 60% of these patients may have sequelae like persistent wheezing, bronchiolitis obliterans, bronchiectasis, and others. Adenovirus may also cause gastrointestinal infection, genitourinary infections also, and even CNS. Like this 10-month-old baby, cough, cold for 4 days, fever for 3 days, even respiratory distress for 1 day, then had 3 episodes of generalized tonic-clonic seizure followed by refractory status. Among all the investigation, the CSF analysis revealed aseptic meningitis, but there were MRI changes in the brain that we can find here. CSF and respiratory viral PCR both were positive for adenovirus. So this is the spectrum of adenoviral infection, from eye to genitourinary to skin to GI tract, respiratory system. Even it may cause congenital infections, cardiovascular system like myocarditis, dilated cardiomyopathy, pericarditis, in CNS, encephalitis, and among others there may be arthritis, thyroiditis, deafness, and even obesity is linked to adenovirus. So this is the huge spectrum of adenoviral infection that we may get. Thanks for watching Academics in Nutshell. See you again sometime later.